This is going to be topic 42, Trauma Overview.
And key concepts. Upon completion of this chapter, you'll understand that trauma is a devastating and potentially preventable condition, the dramatic impact of trauma systems can have on morbidity and mortality, the ways field triage optimizes a patient's chance of survival, how mechanism of injury and kinetomatics lead to a predictable injury pattern, and how laws of physics affect kinetomatics. Overview. Trauma, injury caused by excessive physical forces, and there's a lot of different kind of forces here. There's mechanical forces, heat and cold, electricity, chemicals, ionizing radiation, occurs when essential substances are withheld, and an example of this would be oxygen deprivation, like in drowning. Injuries can be caused intentionally or unintentionally, and wounds may be penetrating or blunt. Injury prevention. Trauma injury is preventable. Injury prevention programs, evaluation of risk factors. Risk factors increase in an individual's likelihood of developing a condition, and that's what risk factors are. Behavioral alterations, like public education to reduce diving while impaired, environmental observations, living condition, detection of threats, lack of smoke detectors, medical conditions, hypertension and stroke. The primary prevention modes are education, enforcement, and engineering. In education, changing behaviors by making individuals aware of the risk and actions that they take. Enforcement would be fines, penalties, and even imprisonment can be used to elicit a greater and more rapid change in behavior. Examples of this would be seatbelt laws. And then engineering, better designs to reduce potential for injury. This is the Haddon matrix for near drowning. And the host here, the agent, physical environment, social environment. So this is to look at the overall, this is like a risk assessment. So this would be the pre-event. Pool safety education would be the way to maneuver the person into a more enlightened viewpoint. In the events, like submersion, host physical condition, wearing a life jacket, alcohol consumption. Prevent or post-event, near drowning, physical condition of the host and alcohol intoxication, comorbid factors on that. As far as the agent goes, water depth, water temperature, depth, and clarity of the water. Was the water really nasty or was it fairly clean and clear? Physical environment, pool cover, four sides, pool fence, was all these safety things engaged? Submersion in the event, dual pool drains and pool depth, pool alarm. Post-event, locations of life preservers, boats, ropes, resuscitation equipment, cell phone. Social environment, boating or swimming regulations, adult supervision, lifeguards. In the pre-event, during the event, buddy swimming, lifeguard present, they can intervene. And then post-event, emergency medical services, community CPR, 911 services, cellular services. So all of these are like a threat assessment. Depending on how many of these you have would tell how the outcome would be. Trauma systems. Early modern EMS history recognizes the importance of trauma care. The government took a regional approach, rapid patient movement to trauma centers from anywhere in the region. Trauma systems, early modern EMS history recognized the importance of trauma care. Government took a regional approach here. The trauma system development, important events like the White Paper, which resulted in the Highway Safety Act of 1966. Focus on this was to guide and develop EMS services, improve equipment communications and transportation, and develop training standards. The Trauma Care Systems Planning and Development Act of 1990 and 2007, 1990 defined components of a trauma system and designated funding. In 2007, restored funding provided by the 1990 Act and expanded reporting requirements. So a little bit of another infusion of governmental money for something that is very expensive. Trauma center designation. Trauma centers National standards published by the American College of Surgeons, criteria for trauma center designation. Level 1 is a 24-hour in-house general surgery, intervention, and specialty care. A Level 2, 24-hour immediate care by trauma surgeons as well as specialty care. A Level 3, 24-hour coverage by emergency medicine physicians and promptly available of general surgeons and anesthesiology. A Level 4, 24-hour emergency department facilities with the ability to implement advanced trauma life support protocols and a 24-hour laboratory coverage with transfer protocols and formal transfer agreements for patients requiring a higher level of care. Trauma registry and pre-hospital trauma research. Trauma registries and pre-hospital trauma research. Trauma registries provide trauma-related data from pre-hospital care and hospital trauma data, vital to medical research advancement. The National Trauma Data Bank is the largest registry. The National Emergency Medical Services Information System, or NEMSIS, data collection standards to maintain a national EMS dataset collection from all states on a limited number of data elements. Field triage. Process of sorting patient and prioritizes the need when resources are limited and determine the appropriate destination hospital as well. Important concepts on field triage: an algorithm that includes anatomical issues, psychological issues, and mechanism of injury, has decision parameters designed to aid in making treatment and transport decisions. Under-triaging is underestimating the severity of trauma patients, and over-triaging is overestimating the seriousness of the patient's injuries. And this is a field triage decision scheme. This is figure 1.6 in your book. American College of Surgeons Field Triage Criteria of 2006. Take a look over this, be familiar with it. ABCs is probably going to be red. Anything that can be treated within 2 to 4 will be a yellow category of some sort. Anything that can be treated within the next 12 hours or so would be a green or minimal. And then if we don't expect them to survive their injuries, they're going to be, depending on your color coding, blue or black, which would be expectant category. Mechanism of injury. Special forms of energy can predict or can create a predictable injury pattern, and this is kinetomatics essentially, predicting life-threatening injury presence, even if not apparently external. The purposes of documenting and reporting identify the need of reassessment and transport, and they also have research implications, which is prevention. And that would be this right here, the purpose of documenting and reporting that we just talked about. And we're going to talk about energy a little bit more in this next section. Physics of trauma. Sources of energy. There can be all types of energy. The next slide we have a couple figures to show you as well. The kinetic energy is the movement. Vehicle driving down the road is an example of this. And the potential energy is the energy stored within a mechanical system ready to become kinetic energy. Chemical energy is stored in chemical bonds between molecules. Thermal energy, explosives create pressure waves or shock waves as a result of energy release when chemical bonds are broken. This would be thermal. Electrical, lightning strikes and electrocution. Barometric results in changes of pressure which can cause high-altitude sickness and scuba diving injuries. Sir Isaac Newton, law of inertia. All objects remain at their state of rest or in motion in a straight line unless acted upon by an outside force. The force is equal to the product of the mass and acceleration. For each action, there is an equal and opposite reaction. And we've probably heard that version of it before, or that part of it. Figure 1.8 on the next slide, law of inertia, and figure 1.9, force equals mass times acceleration. Let's take a look at these. Now, if these two strike one another here, the original path of this will be deflected. That means there is movement of energy this way. Well, anybody that is in the side of the car could get that energy delivered into them. Now, force time equals mass times acceleration. Now, kinetomatics, kinetic energy, that's what we're talking about, equals mass times velocity squared. This is very important. Now, why velocity is very important. The faster that you have a motor vehicle accident, or the more speed that you have applied to the motor vehicle accident, the greater chance that you have of kinetic energy units being delivered into your patient. Effects of change in mass and changing of velocity or kinetic energy. All right, so this is velocity at 265 meters per second, and this is velocity at 530 meters per second. Let's look at this in newtons here. The change in mass, this is what it was originally, and we essentially doubled the size of the mass, and pretty effectively doubled the size of the newtons, but a change in velocity of a 0.15, still the same weight, but we have increased the speed four times the amount of newtons, 4 times the amount of energy. So the velocity squared is how this is figured. So very simply, that the more velocity something has, the more energy it delivers. Blunt trauma. Internal injury. Does not result in penetration, often leaves skin intact. Signs may not develop for hours. Automobile accidents, the greatest number of blunt trauma fatalities. Figure 111 in your book. The vehicle's interior must be assessed for damage to determine energy transfer during the body collision. So if we have intrusion into the vehicle, that means that whatever hit the outside of that vehicle and intruded into it, all the energy was delivered into the patient. That would be a high mechanism of injury. Common injury patterns. Head-on collisions. Most of them are offset. It would be one's going this way, one's going this way. High energy whenever they strike. Rollovers, we don't exactly know where all they've hit, because every time that the car rolled over and it pointed at impact at various locations, the patient, if they were flying around the inside of that, impacted at that point. So we could have multiple injuries that from a rollover, because the patient has now come into contact with multiple sections of this car and multiple areas inside. So lateral impacts delivers the most energy to the same side occupant. Head and chest injuries are probably possible in this. In the rollovers, there's no single predictable injury pattern. Rotational collisions, vehicle is struck on one side of the four corners, causing it to spin. We can get shearing injuries from this. Rear impact, we get things like whiplash, lumbar spine, and intra-abdominal injuries. Ejection. Ejection is one of the most catastrophic, primarily because of secondary impact, because at the point that the person is sped up, he is going the same velocity now as the vehicle once was, or wherever the energy was whenever that vehicle stopped and he got ejected, or she got ejected. And now that energy is taken over by the person's body until they come into contact with something else. Generally, that something else is stationary. Occupant restraint systems significantly reduce risk. Things like lap belts, headrests, and then airbags. Proper seatbelt position optimizes the safety for children, and this is figure 119 in the book. We don't want it to where it will cause them C-spine injury. Additional blunt trauma causes, tractor accidents, high center of gravity and high risk for overturning, small vehicle crashes like motorcycles, affected by same type of impact as occurs in automobile collisions, only the person is not protected by anything. All-terrain vehicles, three-wheelers, have a high center of gravity, prone to rollovers. Personal watercraft injury patterns are similar to motorcycle injuries. Snowmobiles, injuries are similar to those linked with all-terrain vehicles. Pedestrian injuries, vehicle impact speed is the most important variable influencing the severity of the injury. Falls, 4 factors affect the severity of the injury: distance of the fall, what they landed on, patient's position at impact, and the patient's overall general health. Penetrating trauma. Skin is disrupted. Entry of the penetrating object into the tissue, like a firearm, knife, or anything else that would enter into the spear, piece of metal that doesn't really belong. The general characteristics of an exit wound is as this bullet enters, it causes a cavitation wave. And that's the energy wave that's delivered into the tissue, and then on exit we get kind of a tearing, splitting, and a blowout sensation. So generally our exit wound is the larger of the two wounds. If it's pretty close, we get abrasions, burning, and tattooing that occur on the front end. So things to watch for when you're trying to figure out if it's an entrance or an exit. Penetrating trauma continued. Ballistics. Study of motion and its effects on projectiles. Gunshot wounds. The severity depends on the type of the weapon, velocity of the projectile, and when it strikes the tissue. Physical properties of the projectile, and the type of tissue impacted. So if it hits bone or something like that, it can break away bone, and then that increases. Cavitation wave was normal through this if it was going through soft tissue, but let's say it hit bone and now it's a much larger piece because it's now carrying the bone through the tissue, so it causes a greater cavitation wave. Body armor. Hard body armor made of thick ceramic or metal plate. It's hard enough to deflect the force of a projectile. Provides much more protection than soft body armor, but is also much more cumbersome to wear. Soft body armor is made from Kevlar or some other fabric, worn during most routine activities due to its increased flexibility and decreased weight in comparison to hard body armor. Stabbings. Severity is not easily predictable by observing the external injury. Factors are the potential depth of the injury, if the type of weapon is known, the angle of the weapon during penetration, and the anatomical area. So I'll clear this off and give an example of that. Let's say we entered here, the knife's handle, and the rest of this is knife. So if I wasn't there and physically witnessed it, very easily anything in this damage path here could be injured. Now if that was in a soft tissue, say over the lung, I could have lung injuries anywhere in this area, depending on the angle that they actually took the knife, the attacker. Blast injuries. There are several different types here. Primary blast injuries. Direct effects immediately after the explosion is the primary blast injury. Secondary blast injury is caused by propelled debris that would be in the blast wave. Tertiary blast injuries is the patient is thrown. Quaternary blast injuries, burn, crush injuries, or etc. And quinary blast injuries are things like bacteria, radiation, and chemicals that might have been in the blast radius. In conclusion, paramedics have a vital role in injury prevention. Field triage criteria incorporates information in the scene size up and primary assessment that will formulate your ability to sort your patients. Understanding trauma physics, allowing paramedics to predict injuries and many types of trauma.
If you have any questions concerning this topic, feel free to contact me. My name is Roy Smith, SmithArtSamaritanEMSOK.com, or 405-492-8243. Thank you.